I was told to go see a urologist and have that checked out, and it was eventually time for a biopsy. And the urologist that I had at the time, I was not comfortable with him, and I was looking not necessarily for a second opinion, but for someone that showed a little bit more interest in me as a person. I went back to my insurance, and they referred me to the practice that I'm here with Dr. Sanford and Dr. Michel, the surgeon. And I felt like, well, it's a way more thorough approach, and more attention being paid to me than with the other guys. And sure enough, after the values didn't go down, after we had the antibiotics and everything was excluded, a biopsy was arranged. And that in itself can be a scary proposition, because I heard from my father-in-law, that's a very painful thing and all that stuff. And it turned out it wasn't, because some places they use I guess lidocaine or some pain numbing medication, and that was generously applied here in this practice, and it was a painless affair. Obviously, it turned out to be a cancerous situation, and through that biopsy, they were able to localize it as being inside and not having spread yet, and all that. And then we discussed having surgery. And of course, then comes the fear of impotence, incontinence, all that stuff that goes with that, and the overall aspect of you're looking at cancer, which is always something that is a life-threatening moment, at least in your perception, even though it didn't turn out to be that way in my case. And when the biopsy was done, we basically scheduled surgery after I, had some time to think about it. And we proceeded with the surgery about a couple of months after the biopsy was diagnosed. I was treated like a king. I mean, it was the most friendly personnel, and later on I found out that is because of the good relationship the doctor has with the hospital. So that's always a good sign to have that. And then I was physically a good candidate for laparoscopy, which is the external, just through a few holes they poke into you, don't get filleted open, and I thought that was kind of nice. And physically, since I wasn't obese or anything, that worked out really well for me. It shortened the time of recovery. I was happy about that. The impotence was a scary part, and definitely, I was concerned about that, being relatively young and having an active sex life anyways. What worked well for me was the encouragement to stimulate myself and to reestablish the connection between the brain and the genitals, basically, and with the help of all the erectile dysfunction drugs. And then 3 months after that, so 15 months in my case, all of a sudden I had a spontaneous erection without the help of any kind of medication, and the key to it was hard enough for penetration. That was the key for my marital happiness and my own happiness, was, it can be done. And that's from that point on, I just relaxed also mentally more. It's like, okay, we're working on this. And after that, it's become better and better over time. This is much later I read the statistics on all these procedures, and I did not even realize until much later how much it has to do with the doctor that you're with. And there are artists out there, just like anybody, anything else. There's guys that can do the job, but there's guys that do it very, very good. And that is how I felt here. And it's always been like, it's almost like you have a friendship that you develop here, because you will see your doctor that treated you for a very, very long time, and you might as well pick one that you're super comfortable with, and where you feel like that even if there's a future problem, that'd be the guy you'd want to go back to. I mean, I'm a craftsman myself. I'm a guitar maker by trade. So I know, what it takes to really love what you're doing. And that is what I'm always impressed. And I like to surround myself with people that are very, very good at what they do because they love what they're doing. And that's what I found in Dr. Michel was, hey, that guy really loves his job. And why wouldn't you want to be with someone that that treats you, that does just that too and excels at it. I have to say, having cancer and the cancer experiences, in my opinion, cancer is something that has also to do with the lifestyle that one leads. And for me, that was a clear signal to change my lifestyle a little bit. And I changed it by being physically more active. I picked up exercise. I found my sport, paddle outrigger canoes in the ocean, and that led me to change my outlook for myself, more energetic. I lost weight. My wife found me more attractive because I lost 20 pounds. I didn't have the gut. I was not a couch potato anymore. And that was the other part, that you get stimulated by such an experience where you say, hey, look, life's too short. You need to be active and find something that you like to do that keeps you, a healthy mind and a healthy body. So I worked on the healthy body, which reinforced the healthy mind and all that.